Hi everyone, and welcome to our webinar on the notified body's role in medical device certification. My name is Sarah Steck, and I'm the Legal and Regulatory Director here at L&E GMed North America. We put this together because we always receive phone calls and questions from people that are either new to the European regulatory scheme or that don't know about our role as a notified body and how it plays into the European regulatory scheme. So, if you're looking to either get an introduction to a new regulatory scheme or fill in the gaps in the knowledge you already have, this webinar is for you. Now, this webinar is pre-recorded, but I'm here at the computer to answer your questions as the webinar runs. We'll have about 10 to 15 minutes of question and answer time at the end, and I'll stick around for that as well. Feel free to ask your questions in either the chat box you see on your screen or in the Q&A box. Whatever questions we don't get to at the end, we'll send out the answers. Also, we'll send out the slides in about a week. If you have any further questions, please don't hesitate to send us an email or give us a call. As many of you already know, we're always happy to pick up the phone or reply to an email, so don't hesitate to drop us a line. In today's webinar, first we'll do a quick introduction to CE marking in general, where it comes from, what it means, things like that. And then we'll go into conformity assessments and how conformity assessments fit within the CE marking scheme generally. And finally, we'll get into the meat of the webinar, talking about notified bodies, what they are, what they do, what they can't do, and how to choose one. So we'll start out broad and narrow it down so you can see how notified bodies fit and relate to the different actors, like medical device manufacturers and competent authorities, within the CE marking scheme. So then, let's get started. First, let's go through what is CE marking. The CE in CE marking stands for Conformity Européenne, or European Conformity, if you are an Anglophone. When the CE is affixed to a product, be it a medical device or something else, it means that the person responsible for manufacturing the product, according to the directives, declares that the product conforms to the applicable European Community provisions and that they followed all the necessary conformity assessment procedures. So what does that all mean? That was a big long sentence. What does it mean? It means that when you put the CE marking on your product, you declare that it conforms to any provisions that it needs to, and to make sure that it conforms, you followed the procedures to assess its conformity. So, when you see the CE marking on different products, including everyday consumer items, it means that the manufacturer went through the conformity assessments as well. So now that you know what CE marking means, when was it created? CE marking was created by the New Approach Directives. The New Approach predates the creation of the EU, and it helped to harmonize standards across the different European countries and bring down technical barriers to trade. So, before the New Approach Directives came out, medical device manufacturers had to apply individually to each country, satisfy each country's requirements separately for all the different European countries. The New Approach Directives, however, harmonized and standardized the essential requirements for devices, references to harmonized standards that give a presumption of conformity to specific essential requirements, how competent authorities survey the market, and conformity assessment procedures. After the New Approach came the Global Approach, which helped to create the procedures for accrediting or notifying the various notified bodies. As a result of the New Approach and CE marking, the EEA has an internal market with free movement of goods and no technical barriers to trade. This means that a medical device with a CE marking that was granted in one of the member states can be launched on the EEA market as a whole generally. In the meantime, devices have stayed at a high level of safety and performance and a high level of health care. There are a few derogations among the different EU member states, mostly to do with the different competent authority over the country's medical device market. Specifically, registration in individual countries may be required depending on the type of device. However, CE marked goods can generally travel freely around the EEA with no barriers to trade. Now, I should note here that a common misconception that CE marking means that the device is approved. A CE marking isn't an approval marking, but rather it's a symbol that the device conforms to all the essential requirements. So how do you know if your device conforms to all the essential requirements? Well, you assess it, of course. Performing a conformity assessment is the method that manufacturers have to use to have the ability to put the CE marking on their products. By performing or going through the conformity assessment, the medical device manufacturer proves that his device conforms to the essential requirements in the directives. For devices whose conformity assessments require a notified body, the notified body performs the conformity assessments. Now, as you'll see, Class 1 devices that aren't sterile or don't have a measuring function don't require a notified body to perform a conformity assessment. Some other products directives also require notified bodies to perform conformity assessments. Now, the conformity assessments are all included in the directives regardless of the product that they're for in the annexes. A breakdown of all of the conformity assessments are on the next couple slides. On this slide, you'll see the conformity assessments that are included in the Medical Device Directive and the Active Implantable Medical Device Directive. The major conformity assessments are in Annex 2, 3, and 7, although as you can see, not all conformity assessments can be used with all classes of devices. Class 1 devices only need a declaration of conformity to receive a CE marking, whereas Class 3 devices and active implantable medical devices require a full quality system assessment and a type or design examination assessment. On this slide are the conformity assessments that are required for in vitro diagnostic devices. Don't forget, IVDs have their own directive and their own classification system. With the new regulation that's coming out, the classification system is predicted to change. In the meantime, these are the conformity assessments that you can use when applying a CE marking to an IVD. Now, as with the MDD, the Medical Device Directive, the conformity assessments for IVDs are found in the annexes to the IVD directive. As you saw, conformity assessments depend on the class of the device. As the directives describe the conformity assessments, they also tell you which classes of devices follow which conformity assessments. For medical devices and active implantable medical devices, the directions to match the class of the device with the appropriate assessment are in Article 11. For in vitro diagnostic devices, these directions are in Article 9 of the IVD directive. Now, the directive pretty clearly points out which conformity assessments go with which classes, and for most classes of devices, there's a choice as to which conformity assessment you can do. Now, this choice is strictly up to the manufacturer, not the notified body, based on the business model, the device, and how much each assessment costs. Now, notified bodies are needed for most medical device assessments, specifically for all conformity assessments for all classes of devices except Class 1. Manufacturers also need notified bodies to do the conformity assessments for IVDs classified in Annex 2, List A and B, and some self-testing devices, depending on the assessment route that's chosen. So now I've talked about CE marking and how to get CE marking through conformity assessments. And I've also mentioned that most of the time you need a notified body to do the conformity assessment. So now let's talk about notified bodies. I know that a lot of you already work with a notified body, and maybe us, maybe another one, and so you may already be familiar with the fact that we do the conformity assessments. But you may not be familiar with everything that we do, so let's keep going. Now, a notified body is an independent certification organization that is notified by a European member state's competent authority to determine if a product or system meets the applicable requirements for CE marking. So what does that mean? This means that a competent authority designates or notifies an independent organization to perform conformity assessments for specific items listed in the directive. So, for LNE-GMED, the French competent authority, ANSM, has designated us, or notified us, to perform conformity assessments for medical devices. I should note that even though we're just designated by the French competent authority, we're able to perform conformity assessments for the entire EU, like all notified bodies. So, once we're recognized by one competent authority, we're recognized by all of them. There is no notified body that is designated or notified by more than one competent authority. Now, not all notified bodies are notified to be able to perform conformity assessments for medical devices. Instead, some notified bodies may focus on things like construction products, or toys, or communication devices, or other items that also have their own directives. The notified body will tell you if it's not notified to your product or a specific conformity assessment. So don't worry about accidentally contracting with a notified body that only handles, say, construction products to perform conformity assessments for your medical device. To see a list of all the notified bodies and the scope of their notification, you can check out the NANDA website at the address that you see. You'll be able to search both by body as well as by directive to check out which notified bodies are notified to which directives. Now, I should note here a common misconception that notified bodies are like the FDA in the US. We're not. Unlike the FDA, we don't really have any enforcement power beyond issuing, maintaining, suspending, and withdrawing CE certificates. And the competent authorities are the ones that handle market surveillance. So, notified bodies don't investigate manufacturers, and notified bodies can't order recalls or pull devices off the market. That said, notified bodies still play a pretty important role in getting a device in Europe because the conformity assessments they perform are a prerequisite for CE marking. For most medical devices, a certificate from a notified body is required for the manufacturer to be able to affix the CE mark on its device. Now, the last note on this slide is that notified bodies must be independent from their clients and other interested parties. It's true that notified bodies are commercial entities, and that medical device manufacturers have to pay for their services. However, a notified body can't be owned by a medical device manufacturer or be otherwise economically tied to make sure that the notified body maintains its independence. Now that you know what notified bodies are, let's talk about what they do. A notified body's primary task is to provide conformity assessment services according to the directives, taking into account all the relevant guidance documents and standards. This means that in order to perform the conformity assessment services, notified bodies do a whole lot of other activities than just showing up at a manufacturer's facility to see what's up. Before performing the conformity assessments, it confirms that the manufacturer classified its device according to the classification rules in the MDD or the IVDD. To perform the conformity assessment services, a notified body can verify products through sampling and testing, certifying and auditing quality management systems for various standards and directives, assessing the technical documentation for the devices, and auditing critical subcontractors when they need to. If the manufacturer has a favorable assessment from a notified body, then the notified body issues the CE certificate. A manufacturer can be assessed a couple different ways. First, a notified body can perform quality system audits, where it verifies that the manufacturer defined, documented, and implemented policies, procedures, and practices to control and manage their activities. Second, a notified body can also perform tech file reviews, where it verifies that the technical documentation for a device demonstrates that the product complies with the essential requirements. These two types of audits or inspections are the primary ways that a notified body performs conformity assessments. Notified bodies, just like medical device manufacturers, have conformity assessments of their own that they have to follow as well. Competent authorities assess notified bodies routinely through a couple channels, mainly through communications and inspections. This means that a competent authority checks in with notified bodies to both ask questions and justifications for why a notified body made a specific decision, and the competent authority can inspect the notified body or witness an audit that it performs. Now, during a witness audit, the competent authority is focused on how the notified body conducts the audit and what it audits. Notified bodies are in constant communication with competent authorities regarding the assessments that they perform and their findings, the certificates they issue or withdraw, and to provide information about any assessments they performed to support a certification decision. So, just as notified bodies assess medical device manufacturers, competent authorities assess notified bodies. Also, in terms of how notified bodies are assessed, notified bodies must inform competent authorities of any significant change in its organization, just like medical device manufacturers. This is because notified bodies have quality systems too, and any changes to their quality system should be reported to make sure that the notified body can maintain its duties with respect to manufacturers and competent authorities. Now, notified bodies can't do everything in a conformity assessment, especially with respect to a device that incorporates a drug, a human blood derivative, or a product of animal origin. These products are pretty heavily controlled by the competent authorities, and so the notified body must go get an opinion from the competent authority about the products before issuing the CE certificate. Now, why specifically these products, though? Well, because the substances are controlled by other regulations that involve the competent authorities. The competent authorities, who are in charge of market surveillance, need to be able to have a view on substances that aren't normally involved in medical devices, and so could affect a person or even public health in a different and potentially dangerous way. Now that you know the breadth of what notified bodies can do, let's talk about what they can't do. As I mentioned, notified bodies have a variety of duties. Now, to maintain those duties and to keep on the right side of the regulators, notified bodies have some limitations to what they can do. First, to maintain their duty of impartiality, I already mentioned that a notified body can't also be a medical device manufacturer or otherwise economically linked to a manufacturer outside the scope of the regular notified body activities. This also means that a notified body can't be an EU authorized representative, a supplier, or a competitor of one of its clients. Usually, that is expanded to include consulting, so notified bodies have to be very careful if they point a manufacturer in the right regulatory direction with respect to their product or quality system. Notified bodies have to maintain a limit, where if a notified body did provide assistance to a manufacturer, that assistance cannot in any way affect a notified body's certification decision or review. Notified bodies also have a duty of independence from manufacturers. However, notified bodies may have people on staff who used to work for one of its clients. We do. This is especially true as staff members usually have a particular expertise that they learned while spending many years in the industry. Managing conflicts of interest are mandatory and closely watched by the competent authorities. When working for a notified body, all staff must declare any potential conflicts of interest to ensure that no economic factors influence a decision, and the notified body must take that information and put the necessary controls in place in order to further ensure that no economic factors influence any sort of certificate decision. Notified bodies also have a duty of confidentiality, so they can't, without permission, disclose their clients or their clients' products or technology to anyone but the competent authority. This duty starts as soon as the potential client contacts a notified body, even without any kind of confidentiality agreement changing hands. Now, notified bodies are required to report this information to the competent authority if the competent authorities ask for it, but they can't broadcast it to the general public what they're doing for each client. Notified bodies also have a duty of competence, meaning that when a notified body is notified to a specific directive and conformity assessment, it has to maintain its competence by having the right people on staff, making sure they are trained properly, having the right equipment, etc. This also means that notified bodies can't carry out conformity assessments for which they aren't notified. Like I said before, a notified body that is only notified for, say, construction products can't perform conformity assessments for medical devices. Now that you know what notified bodies are, what they do and what they can't do, how do you choose? There are a ton of notified bodies notified to the various directives, and it can be hard to decide which one to go with. Yes, this is true, that medical device manufacturers have the choice of notified bodies. They aren't really contractually obligated to work with a specific notified body for any length of time. However, there are some criteria to keep in mind when choosing a notified body. First, make sure that the notified body is notified to the directive for the device you're using, and double-check that the notified body can perform the conformity assessment you need. Second, service. Notified bodies are diverse, just like medical device manufacturers, and so manufacturers have different needs from each other and need notified bodies that can offer them the best fit. As a result, make sure your notified body's customer service and service offerings fit you best so that you can have a real partner in your device's certification. Third, make sure your notified body and its auditors have the correct expertise for your device in order to make an accurate assessment. L&E GMED has some pretty stringent auditor qualifications to make sure that this happens, that we send an auditor who not only knows what they're doing, but also understands your device and the technology behind the device in order to give a more accurate assessment. A notified body's reputation is another criteria that manufacturers can use to figure out which notified body to work with. As you've seen, notified bodies have some pretty strict ethical duties that they have to follow. A notified body's reputation can kind of precede it in this way, in which the way it works shows how seriously it takes its own ethics. You may have heard about the Notified Body Code of Conduct, written by the NB5, which L&E GMED is part of. This voluntary code of conduct is a way that notified bodies can show their commitment to customer service and maintaining their ethical duties to ensure the devices in the marketplace remain safe. Finally, you can look at the markets that a notified body can provide you with outside of the EU. Many times we've seen manufacturers start marketing their products in Europe and then slowly expand into the US, Canada, and Japan. You may want to keep one notified body for all your market access needs, depending on your needs. Okay, so that is just about it. Now today we went over CE marking generally, and then the conformity assessments, which are a prerequisite for CE marking. And then we went over the role of the notified body and how they perform the conformity assessments, their roles with respect to manufacturers and competent authorities, and limitations to the services that they can provide. If you have any questions, we'll stick around for another 10 or 15 minutes or so to answer them. Feel free to type your question into the chat box on your screen or the Q&A box on your screen, and we'll do our best to answer them. If we don't get to all of them, we'll respond via email. And, like I said, we're going to send out the slides in a PDF in about a week, once we make sure that they are secure. If you can't wait and we don't get to your question, feel free to send us an email or give us a call. As many of you know, we're always happy to talk and answer questions for you. Thank you very much.